Today, we stand in footsteps millennia old. May we acknowledge the traditional owners whose cultures and customs have nurtured and continue to nurture this land, since men and women awoke from the great dream. We honour the presence of these ancestors who reside in the imagination of this land and whose irrepressible spirituality flows through all creation. I begin by acknowledging the Kalkadoon peoples as the traditional custodians of Mount Isa and its surrounding land and waters. I wish to pay my respects to elders, past, present, and extend that respect to all Aboriginal and Torres Strait Islander peoples here tonight. Good evening and welcome to Go Rural Virtually in Mount Isa. My name is Meredith and I'll be your host and Mount Isa tour guide tonight. Welcome to our online audience and to the Go Rural Virtually panel. Although Mount Isa has a population of 23,000 people, somehow it seems like you know everyone. So let's put this theory to the test. Linda, I'll get you to start by introducing yourself and telling us where you work and what your role is there before passing the virtual message stick on to someone you know personally and or professionally. We'll keep the message stick going until all the speakers have been introduced.
If you come to a rural site, you will realise, especially when there's a lot of Aboriginal people, how important it is to know where people are from and what community they're from. And that's one thing that is quite unique to this type of rural work. So I'm a social worker by trade. I work for James Cook University and I'm the Senior Academic Lead for Allied Health here at James Cook, and I've only just commenced in the role, which is just such a great opportunity for me and I'm really loving it. So we organise placements for students and do a lot of supporting for students if they want to come here, and also a lot of support for new grads who come here. So our role really is to give students of allied health and medicine and vet and lots of disciplines an opportunity to come and work in a rural setting and hopefully encourage them to come back once they've qualified to work in a rural setting. So that's a little bit about me. I'm more than happy to answer any questions that you have about Mount Isa or working rural or remote, because I've worked in places like Cooktown, Hopevale, Woodgill, Emerald, Townsville, Mount Isa. So I've worked in a few different locations. And I'm going to pass the stick to Rani.
Thank you, Linda. My name is Rani Cottrell. I work for NWRH and I'm the Integrated Allied Health Manager, and I'd also like to acknowledge the traditional custodians of the lands on which we meet today, the Kalkadoon people, and pay my respects to their elders past, present and emerging. I came up here 10 years ago, almost 11 years ago, as a podiatrist and have stayed with NWRH the whole time. I have a deep passion for working with the rural and remote communities of our Northwest and Central West regions. I have a deep passion for helping students and new graduates work their way through and allowing career progression. So I think that it's a really exciting opportunity. Came out here with a 2-year contract thinking, oh, what happened if I don't like it? And here we are 11 years later. It's just, we call it the land of milk and honey. It's a beautiful place to live. So I will pass on the stick to Lynette Stenhouse.
Thank you, Rani. Sorry, I just had to run off. Someone was madly knocking at my door, but there's no fire and everyone's okay. Lucky I know Rani really well, so I actually didn't probably need to hear about her. I'm one of the lucky people that when I was going bush, I got to meet Rani when there was a slight car problem for our friends. So we've been friends for a while out here. Yeah, I've been in Mount Isa for 11 years and been in health for about between 6 and 8 years. A social worker by trade, and have worked for a few NGOs and now work in the mental health department. I think some of the stuff that I've really liked out here in Mount Isa is all the connections that we make professionally and personally that help you get through tricky situations or are able to help you with information maybe you don't know about or services you don't know about, but equally the job opportunities that I've been able to receive out here things that I wouldn't have got as early on if I probably were in different locations. Out here, if you don't know someone's name, like know them personally, you know their name from working and hearing great work that they do. So there's even a couple of people on here that I've not yet met, but I have heard of them already, or I've had the pleasure with working with through different organisations. I think, yeah, some of the stuff out here that I've been able to experience, because you're often in teams, but you're not in the biggest team, you get the exciting opportunity, I suppose, I think it is, to be supported, but also to do independent learning, to figure things out for yourself and go back to your boss or team leader, whoever it is, and really nut out with them. Hey, this is my problem. This is what you suggested, and this is what I've gone and looked at myself. So you get to sort of be autonomous in that way, but in a supported environment. So I think that's pretty cool for people that are just come out from uni, that are used to learning, that often maybe have a hard time with the flexibility or the uncertainty. But at the same time, it's pretty cool because you get to go and learn a whole new way of doing things and can check in with someone on the ground that's probably been there before you and is excited to hear what new ideas you have. So I think that's definitely something that I've noticed in all of the workplaces I've worked at here. And yeah, I love all the things we get to do personally out in the bush as well, especially the no mask wearing and the events that are going on this year that a lot of other places aren't getting to have. So we're really lucky. Yeah, I'm happy to take questions whenever as well, but seeing as we're passing the message stick on, I'm going to pass it on to Cheeky Jacob.
Thank you, Lynette. So my name's Jacob. First moved out here in 2019. I came as a new graduate exercise physiologist. I spent 2 years working with NWRH under Rani's wing and sort of travelling between Julia Creek and Camberwell and servicing all those communities there. And it was a fantastic experience, and had I not received the opportunity of a lifetime to transition into cardiac science, then I most definitely would still be there. So yeah, just early this year, just in June, early June, I transitioned into the cardiac scientist role at the hospital, and it has been everything I wanted. So I think that's one thing that I can sort of vouch for is the I suppose career progression in a like very fast-tracked sort of manner, as well as the opportunities, because quite a difficult field to get into in more that sort of metropolitan region. I've tried and gave up. So definitely don't give up. But yes, I think that's one thing I really enjoy about being out here is the opportunities that sort of present themselves to you, as well as the sense of family. You know, I'm sure we'll talk about the barriers and sort of hurdles about living rural. And I'm a very, very big family man myself. So, you know, just making that family out here is probably the thing that keeps me going. So, yes. And with that being said, I'll pass on to my friend Brandon, who I've recently managed to reel on out to the outback. So,
yeah, cheers, Jake. Just my camera's not working at the moment for some reason. Not sure why. But yeah, I'm a new grad. I'm only moving out to Mount Isa in 5 days. So I'm taking the leap of faith and starting a new role out there. I've only done placement 7 weeks prior to in January and absolutely loved it. I mean, made a heap of friends, some that are probably going to last forever now that I'm moving out there. So in that being said, I'm going to pass it on to Vid, who I met as one of the students while I was on my placement. So on you go, Vid.
Cheers, Brandon. I was thinking, who am I gonna like introduce? It's gonna be either Sam, Jetta, or Brandon, because I was there for my placement for around 4 or 5 months at the beginning of this year, and honestly had the best time. So I am Vid. I'm one of the 50 medical students at James Cook University. So currently based in Townsville Clinical School, but in 5th year, I was lucky enough to get a spot out of a couple of students who get to go to Mount Isa to do some of our rotations. So I did that from January through to April, and I had one of the most incredible times in terms of placement. And I've done some placements around other parts of Queensland as well, but within 3 weeks, almost under the wing of Sam Barch, who I'll introduce next. I was like, oh, if I can be a half a good intern as Sam Barch, if I can come up to Mount Isa, follow his footsteps, I'll be very happy. And I come up to, and within like 3 weeks in Mount Isa, I was like, I'm definitely coming back. So hopefully I'm wanting to come back to Mount Isa for my internship year, which is in 2023. 2023. But that's me. I do want to go down the rural generalism pathway. And Mount Isa, I believe, from my experience so far, would give me that exposure that I need to kind of become a multifaceted doctor, who has a bit of an interest in rural, remote, and Indigenous health issues. So passing on to Sam.
Thanks, Vid. I'll try and deflate my head after that. So yeah, my name's Sam. I'm an intern out here at the hospital. Like Vid, I came out here as a student, so I first came out here in my second year of my degree for only a 4-week placement, but absolutely loved it. Knew from that placement I was coming back. So fortunately, I was able to come back. So I was here in my second year for 4 weeks. I came back in my 5th year for 24 weeks, and then in my 6th year for 10 weeks. And all of those placements, I just fell in love with the place, loved the work, loved the people. I met people like Spatuzzo on placement out here. He's come back, I've come back. So once you come out here as a student, it's the work you get to do, the people you meet, the places you go, you can't help but get under your skin, and so many people come back, and there's a reason for that. So I'm out here for this year at least, but I'm on the rural gen pathway. So like Vid said, this is the perfect place to do your rural gen and start your career and get a really good footing. So I'm definitely going to be here for quite a few years yet to come. So I'd like to pass it on to Jenna. I don't know if she's actually on this link or not.
Yeah, I'm here. Yeah.
Perfect.
Hey, thanks, Sam. So as Sam mentioned, my name's Jenna. I actually met Sam through doing the Grow Rural program. And then it was just nice to see him out here as well. And that's also how Viddy, I think we sort of touched base and just had a connection that way. So you're right, I feel like everyone knows everyone. I work as a dietitian out at Gidgee Healing, so working in Mount Isa, but also flying out and doing outreach to Mornington Island. Before that, I worked on the Sunshine Coast, working in Aboriginal and Torres Strait Islander health, and also with Fijian and Solomon Island populations on a research project as well. So I have a really big passion for Aboriginal and Torres Strait Islander health. So yeah, just loving it out here. And as everyone's mentioned, all the opportunities that you get to upskill that you wouldn't get in an urban setting, and which also leads me on to introducing to Danae. So I went to uni with Danae and then also met her out here, and which is also one of the reasons why I took the job out here, because we studied together and knew one another too. So I'll pass on to Danae.
Hey, yes, as Jenna said, I'm Danae. I grew up in Mount Isa and studied on the Sunshine Coast. I'm a dietitian as well, and I work at Gidgee Healing part-time doing public health nutrition work. So currently doing a food security project in the lower Gulf communities. And then I also work part-time at JCU doing public health nutrition work and helping out with student projects when students come out to the region and do projects, which has been an amazing experience. And I never ever thought I'd be where I am, especially so soon out of uni. I finished in 2019, and yeah, the learning has been amazing, and I love the support and the networks, the people you meet here. It's been amazing. So yeah, I might hand over to Kirsten.
Hi, my name's Kirsten, and I work with Danae as well. So I'm at Centre for Rural and Remote Health, and also work with Linda. I'm an exercise physiologist, and I grew up rural but did high school and uni in Brisbane. So yeah, I've just sort of gradually worked further west as I've done that, and I've just started to appreciate it more and more. So yeah, I love my job. We get to bring students out here. So Brandon and Jacob are a result of that. So thanks for coming on back out. Really appreciate it. Yes, and I will hand the stick over to, I don't think I've met you face to face, Joe, but I do know your face.
Hi, thank you, Kirsten. Hello, everybody. So my name's Jo. I'm a registered nurse. So I work for Dr. Joss at Leichhardt Medical Centre. Graduated nursing at the Sunshine Coast a year ago, which has gone very quick, and moved to Mount Isa 6 months ago, and absolutely loving it out here. I concur with what everybody else has said. You've all described it beautifully. The people, the sense of community, job opportunities, career advancement opportunities. It's just far and beyond what you get in the metro areas. So I actually never considered rural and remote. I was very lucky to fall into moving out here, and I'm so glad, so grateful. And I'm quite passionate. I'm so grateful for this platform, because I'm quite passionate about getting the word out there to get the healthcare staff that we need, and spread the word of how amazing it is, because I was oblivious before coming here. So I think it's a very good thing what we're doing to raise awareness of the quality of life and everything else that comes with living in these areas. So I actually don't know anybody else here, so I'll have to hand it over to probably Meredith to choose somebody on my behalf, please.
Thanks, Jo, and thanks everyone. The only person that we haven't heard from so far is Louise, who works for Health Workforce Queensland. Louise, do you want to introduce yourself?
Sure, I'm Louise Banbury. I'm the Regional Coordinator for Health Workforce Queensland for Western Queensland. So I've worked with a lot of people, supporting them to get to Mount Isa, either through recruitment, an incentive package, and also advising them of all the other great funding we have available, such as scholarships and bursaries. So on a daily basis, I'm in contact with primary health services to support them in getting people and students like yourselves that are here tonight out to those fabulous areas such as Mount Isa and Normanton and Mornington Island, through Gidgee, Northwest Rural Health, Leichhardt Medical, and all the other primary health services that we support out in that region. So yeah, lovely to meet you all tonight.
Thanks, Louise. Thanks, everyone.
Well, I might bounce in as the other nurse following Jo. So I'm Sabina Knight, and I'm the director of the Murapuni Centre for Rural and Remote Health, and remote area nursing is my background. I'm from a rural background, not quite yesterday, but a little while ago. And I've had a wonderful career in remote work, really. I grew up rural, I did a little bit of work in rural, and then I went remote. I had 30 years in Central Australia, and then I immigrated to Queensland, across the border here to Mount Isa. We have the wonderful opportunity at the centre to, we facilitate and coordinate all the student placements across Northwest Queensland, other places as well, but relevant to tonight, Northwest Queensland. But of course, we can't do that without our partners, the health services, and the individuals who are willing in the health services to support clinical placements, and the students themselves who are here for longer placements, who then mentor and make friends with the students who are here for shorter placements. We also deliver programs locally. So we have a nursing program that's local. We also support vet science students. And the reason I say all of that is for you who are thinking about going rural, it's really important you have the opportunity to meet a broad range of health professionals in training, and to get to know that you're in your own professional bubble, you know, as you're doing physiotherapy or medicine or nursing or occupational therapy, exercise phys, all of the professions we've heard tonight, and many more. And in rural, there, in any small town, there's one of each of those, or one of those passing through. But when you're the new one coming into town, it's really easy to think, oh my God, I'm going to be the only one. Can I cut this? You know, how am I going to feel? Am I going to be professionally isolated? But if you've done placements, you know, where you've been able to share your accommodation with other disciplines and get to know them and build some friendships, where you've been able to get a better understanding of each other's disciplines' contribution to healthcare in context like Mount Isa and smaller places around, then you're going to be much more confident to take up positions when you graduate. And of course, there's an enormous amount of support for graduates. And our centre does that as well. And every individual health professional who's on here tonight, the reason they're on here tonight is because individually they're committed to their profession, but to rural and remote health. And it's not something that is tacked on the CV. It's what defines, that makes good people out here. And so you'll find people who you've got a lot in common with, but importantly, we've created opportunities for you to meet them before. So if you'd been here on placement like Sam for, a few months each year, he would have met people along the way who would know where they are when they graduate. And he would know, if he wasn't here in Mount Isa at the moment and was maybe in Longreach, he'd know that this weekend was the Cloncurry Challenge and who'd be there, and maybe convince some friends to come up and visit. Or if you'd come across a student who was interested in horses or hadn't been to something like that and wanted a bit of a taste of the outback, would be able to say, well, you could either go to Boulia to the camel races, or you could go to Cloncurry to the Stockman's Challenge. And are you interested in horses? Have you got a horse? Or are you, well, here's a place where you can live and work with your horse and participate. Or if you're interested in other sports, there's all these other sporting opportunities. If you're not sporty and you're not horsey, it doesn't matter. There's so many other artistic endeavours. Or if you're like me and you can't do any of those things, you're a great supporter, you turn up and volunteer. But it's about being part of the community. Of course, in your placements, you get all those opportunities because we so nicely volunteer you for them to participate. But also you get to realise, to be a successful health professional in rural, you have to be able to live as well as work in a place. And so it's not all work. You actually need to be able to downtime and do something else that you like. We've just had two of these folk, one and one's not on tonight, just do the week walk, ride, run, palliative care ride from Cloncurry to Mount Isa, where people rode their horses and they walked in some rain to raise money, but also to travel through country that not very many people get to see, which is just fantastic. So all of those things are your opportunities. It's not smooth, it never is, but know that there's support. And of course, this is where you get to really stretch yourself and really get to apply what you've learned in class to practice as a student and then as a graduate, where you really get to stretch yourself and you get to progress quite a bit more quickly than you would in a metropolitan area, because you're competing with a lot of others. And you'll get to have your uncomfortable times when you get really stretched and you get very anxious about it. But in rural, you get lots of opportunities to get stretched, but to have support so that you're not so anxious about it. And if you're not feeling a little bit anxious, then you're not getting stretched. And so you're not testing yourself and being able to move along, get out of your safety zone. And there's plenty of those opportunities. We've just had students come back this week. We had 2 up in Corumba, 2 med students with the nurse practitioners up there. We had 2 up in Burketown with the nurse practitioners there, and 1 in Camberwell with the nurse practitioner there. We've just had 3 vet students out, and we've got a whole raft of wonderful allied health students. And this week's O Week, and our nursing students are starting. And so it's a very rich environment around going rural. So I'll hang up there, and you might find this surprising, but I'm a bit passionate about it as well.
Thank you, Sabina. Thank you. That was a great way to segue into the last and final introduction that we're going to make, which is to the city itself, the city of Mount Isa.
All
Before we sort of break into the more sort of structured discussion, I'd just like to welcome all the students who've come on board tonight and to say the format for Go Rural Virtually is essentially an interactive discussion. So we'll pause for you to ask the panel questions. As you can tell so far, there is a lot of knowledge and experience here tonight. And I know every panelist would love to share that with you. So please, as students, feel free to ask questions. And there'll be plenty of opportunities for us to take those questions, and I'll give you a heads up. But just to start off the discussion, I just want to unpack a bit. Lynn, you were saying that you initially, I know that you came to Mount Isa, you had 1 or 2 years in mind, and you've ended up staying for 11 years. And I'm interested in you telling us about what were the factors that contributed to you wanting to stay in Mount Isa?
Sorry, you were speaking to me at the start then, hey? I just couldn't quite hear you. For me?
Yes.
Yeah, I think the career opportunities for us and the great friendships that we've made helped us to stay in Mount Isa. We were definitely only thinking 2 years, and we're up to 11. And we're probably going to be here for another 9, if I'm honest with you, which, as you can see, Rani's laughing and she thinks that's a good one, but the joke's on her because she'll be here that long too. Yeah, I think just the career opportunities and the amazing friendships that we've made. It's been wonderful to be able to be 5 minutes from work and get home and enjoy all the hobbies or go for a walk with a friend. But my husband and myself have just had some really wonderful career opportunities through social work and management roles with Northwest Remote Health, and the different roles that I've got now as well. Headspace, Bush Kids, it accumulates into a great clinician and a great experience to be able to provide services back to the community. So I think those 2 things, the job opportunities and the people out here, really make me stay.
So there also, Joe, you're a relative newcomer to Mount Isa. You arrived, I know you started working at Leichhardt Medical Centre as a registered nurse in February. And as a newcomer, what kind of challenges have you faced, professionally and personally in settling into a new community?
To be honest with you, I can't really name any challenges. Really, it's all just been so positive, and quite an eye-opener. I keep saying the 2-minute commute to work. I think that was the first thing that really jumped out to me. You start at 8, you leave home at 5 to 8. It's coming from the Sunshine Coast where it's half an hour to anywhere you want to go. So, but just the general support. So it's such a supportive community. If and being made feel so welcome. I honestly haven't come across any challenges either personally or professionally. Dr. Joss and the whole team there at Leichhardt Medical Centre are extremely supportive. So yeah, it's only been 6 months, so give me time. I'm sure I'll stumble across some in due course. But even the patients, they're just just to build up that relationship and have give that continuity of care that you don't get in your metro areas. Building up those relationships, not crossing the line of friendship, but it's close to it. It's really nice to have those familiar faces walking into the waiting room. And yeah, so yeah, to answer your question, there's none as yet, touch wood.
Thanks, Jo.
Thanks, Meredith.
I'm just thinking one of the outstanding benefits of working in Mount Isa is the opportunity it gives for Indigenous people to work creatively within the health system. And Linda, as she introduced herself, is the academic lead in allied health at the Centre for Rural and Remote Health. And obviously has many years experience with being a clinical education specialist and a social worker But Linda, can you provide us with an overview of how you've navigated working in the health system as an Indigenous woman?
Linda, you're on mute.
Yes. I'll go one step back. I actually have worked in child protection as well. So two very challenging areas, especially as an Aboriginal person, especially coming from the same community that I grew up with, a lot of people. Again, I think it's really just the welcomingness of the of people and fellow clinicians as well. So I went to a health forum in Concarry the first week I came back, because I'd left town and come back 2 years later. And a couple of people said to me, oh yeah, I heard you left, but I didn't realize that you were gone for that long. Like, I was just welcome home sort of thing. So some of the things, it's been an interesting experience. Like I've had, as an Aboriginal person, firstly as a clinician, I've dealt with really challenging situations, but people tend to leave that professional stuff at the door. Even like I remember walking into Kmart after I had removed people's children that day, and I was not sure what the reaction I was going to get, and they just smiled at me and you know, we gave each other a look, yep, hi, and just kept going. So that was just, it's just that type of support no matter what happens. In the health service, I've found that at times it has been quite challenging, because there's a cultural divide sometimes in communication and understanding of the needs of Aboriginal and Torres Strait, well, Aboriginal people. And I've struggled with that. Having said that though, it has never been a case where people don't want to learn or people don't want to know more about how they can be more culturally appropriate and how they can communicate better with Aboriginal and Torres Strait people. And if you want to learn that, there are so many opportunities in Mount Isa to do that in a safe and supported way. There is no silly questions. There's no stupid questions. There's no questions that are going to offend the majority of Aboriginal people that you speak to here. And in particular, people on the ground in communities. We've just had our NAIDOC week here, and NAIDOC week here is amazing because there is such a smorgasbord of events that anybody can go to. And, you know, we have a trivia night, which, you know, now that JCU became third, I'll hear about that all year. So we're definitely going to have to beat people next year, can I just say. But having a family fun day, being involved in things like that just really shows how the community comes together and how open and welcoming and gracious everybody, Aboriginal people and non-Aboriginal people, are in this particular community.
Does anybody else want to add to that conversation that Linda started?
Can I just add also, if you really want to do amazing practice, you will see things here and you will work with people here that you won't necessarily get the opportunity to. Like, I've had patients with feet that, you know, they take their shoe off and they've got maggots all through their boots because they've been living in the river. You may not get to see that as a nurse or a podiatrist, etc. Diabetes, chronic diseases, things like that. Like, unfortunately, they're huge issues, but also solving those gives you an opportunity to become involved in a lot of community development work. It's not just a one-on-one type of clinician work. There's lots of community development work as well.
Yeah, and it sounds like those opportunities allow you to take on, broaden your understanding across a lot of areas. It's just not necessarily a clinical approach. Jenna, I know that you've always had a strong interest in Indigenous health. And although you don't identify as Indigenous, was that a concern when you started working at an Indigenous health service?
Sorry, what was the question, Meredith?
I was asking, when you started working at Gidgee, was it a concern as a non-Indigenous woman to be working within an Indigenous health service?
Yeah, so much myself personally, just because I'd had a bit of experience throughout uni. Like I did a placement at the Institute for Urban Indigenous Health, and I also worked for an Aboriginal dietitian on the Sunshine Coast, Tracy Hardy. And so also I've got Aboriginal ancestry on my dad's side, so there was some experience through that. But so for myself, I probably had and also Indigenous Allied Health Australia as well. I'd done some work with them and volunteer work as well. So I suppose I had a bit of background because I was really passionate about it throughout uni. I sort of sought out opportunities to be able to have those experiences. But I think every place is so different as well, and there's so much diversity that exists. So, you know, what might be the case for some areas completely different for somewhere else, and especially urban and remote settings, they're very different. So I think that was maybe the big thing, is just learning a whole new environment, and being open-minded to listen to people's different stories as well, and adapting what might have worked somewhere else to a different setting. But in particular to Gidgee Healing as well, like I get to work with some amazing staff there, Aboriginal health workers or Aboriginal doctors, and just, yeah, amazing people there that if I did ever have any questions, there is that safe place to sit down and have a chat. But I don't know about Danae, how did you find sort of coming out here? And
I think Jenna said it really well. There's just so much support around you, and the workplaces are a really safe place to ask questions and be open to learning and also receiving feedback as well. I found that's been really important. So yeah.
Bidu, did you want to?
Yeah, I just wanted to add on to that. So compared to my counterparts of the students who've been doing their placements either in Townsville, Mackay or Cairns, just by being in Mount Isa, the exposure that I've had to Indigenous health or Indigenous patients has been so much more than the students who have been doing their placements over here. So that opens up a couple of things. One, you get that exposure, but also you get to appreciate some of the health issues that these communities or these groups of people face. And while I was there in Mount Isa, I had the opportunity, and thanks to Sabina as well, I had the opportunity to go to Doomadgee a couple of times, once with JCU and again with the medical team I was there with. And Doomadgee is a discrete Aboriginal community north of there, which, you know, you can't go, it's not a town that you just go visit or anything like that. It is a community that you'll have to go into the council and sign in. And then the exposure that we had there, or the people that we met, like, it was incredible. Some of the things that we got to see, you know, we saw cases of maggots, not in shoes, but in people's wounds in their back. You know, there are some issues that you don't think that you'll see anywhere in a first world country such as Australia, but then you see this, you know, over and over again, and you make you question, how is this fair? How is this even right that we continue to see these things? The other thing is that, like, I think Joe alluded to the cultural safety aspect of it. And I think the thing is that people are very appreciative, even if you give it a go. Like, when I know that I probably crossed some boundaries or made some, you know, did some, you know, probably said something that I shouldn't have said unintentionally, when you're still learning. And I think when they know that you're still learning, you are there with your best interest, with the best foot forward, they are there to support you. And there are so many, as Danae said, there are support people within an institute you go to, you know, to kind of build you up, your cultural safety component, and give you all those tools that you can utilize when you go out bush. Yeah, and another point I wanted to bring out was that in Mount Isa, like, I was thinking that, you know, just because of that sheer quantity or that sheer number of Aboriginal patients that you'd see in Mount Isa Hospital, you know, I was hoping to see, you know, that there might not be a lot of institutionalized racism. But unfortunately, it is something that kind of exists everywhere. And it's something that I also saw at Mount Isa Hospital with some of the nurses that come in, not just nurses, but some of the staff members that come in, and locum doctors that come in and don't have a full wide range understanding or exposure to these. Their understanding, you know, kind of crosses some paths and can come up as a very institutionalized racism. picture, which was a bit worrisome, but that's the beauty of it, I guess. If more people take these opportunities to go out to these communities, see these conditions and these people, and you come back, you have a greater understanding for it, and hoping by the time I come to Mount Isa, there'll be a lot less than what I saw when I was on my placement.
I just wanted to add to that as well, just what Biddy was saying about racism that you experience out here as well. I think it is something that can be a big thing that you do see in different settings. And I think it's important to have your own strategies, to know who to turn to when that happens, to report it, or for someone else to have the conversation with that person, but also just yourself to not get, because I find myself, you might have an encounter with someone and it's heartbreaking, but also you get very mad about the situation and very surprised about some of the things that come out of people's mouths, like you said, because of they might not have had exposure or different things like that. So I think it's also really important to have those strategies to know what your step is, to be like, okay, what am I going to do next? But also just so yourself, so you don't internalize it and start seeing red and not maybe do the best thing.
So this might be quite a good opportunity for the students to ask some questions. You can raise your hand using that option. There's a couple of questions in the chat, some which we'll address later, but the first question was from Victoria, and she's asking who in the panel came from a city? What was it that attracted you in the first place to rural placements? I'm also very interested in hearing about bringing your families with you. Who would like to speak to that?
Sounds like that one was a bit more directed towards Lynette.
I can answer the family question, bringing up a family here. And I think I came here from Coffs Harbour originally. I went to university on the Central Coast down near Sydney. So I think that's, almost metro, that's almost a city. And what attracted me to here, I think, is I was working in Taree. I had my new graduate year at Taree and working with a senior podiatrist that we started doing some work with Aboriginal and Torres Strait Islander, our local ARCHO down in Taree and Foster. And that just absolutely ignited my passion to work with our First People. So I think that I was offered an opportunity in Port Macquarie, private practice podiatry. And my boss at the time said, that's a great opportunity, but have a look at what else is out there. And this is where I found this amazing opportunity in Mount Isa. So I had to choose NGO Mount Isa or private practice Port Macquarie. And I chose the adventure, and that's all it was. And I'm so glad that I took that risk, because I met my husband on the very first night that I moved to Mount Isa. The rest is history. We now have 2 kids. And I just think that along with your question you've asked about mental health and the opportunities that exist out here, it is, and I will pass over to Lynette for more, because she's got some lived experience with that. But Lynette has actually done her psychology degree and then has done a social work degree. And what the opportunities that I can say are available with NWRH, with the Hospital and Health Service, and with Gidgee Healing is, that 4+2 that is being phased out is the provisional psychologists positions that are out here are available. They're here. We're willing to support them. We're willing to supervise. There's people out here. We just want mental health professionals out here. So there is amazing amounts of opportunities for mental health clinicians out here. So I'll pass over to Lynette.
I think you did a wonderful job answering all of it, Rani. I think to add to what you're saying, you've done a good job with the family and city stuff. Rocky isn't really a big city, so I moved here from Rocky, so I don't think I'd have too much exciting things to add in that respect. But when I was working at Northwest Remote Health, so alongside Rani, she was my boss for a little while, and then we changed bosses, but we had the opportunity to bring on 3 provisional psychologists, and it was fantastic. One of the best things that we did for them and for us, I suppose. They were able to get exposure to rural and remote communities, discrete Aboriginal communities that have been mentioned already, as well as having support with their supervision. So that was a really big plus for them, that there was local supervisors or people that had lived here before that were willing to do supervision for them, because we know that can be such a barrier for people entering as a provisional psychologist. It was really great because they got to sort of see kind of what private practice is kind of like, but in a supported environment where you're supporting people on mental health care plans. And that goes the same for a few of your other organisations as well. So provisional psychologists, when there's position, are also, from my understanding, really welcome at Headspace. Also Kidji, when they have that sort of position, they're also really excited to have them over there as well. At Queensland Health, we're really grateful, like in the KIMS team, which I'm a part of, we are able to employ provisional psychologists. Centrecare sometimes have them as well as another family-based service, and sometimes might work in all different programs. So we're kind of really lucky out here that we get to have the early career people, so it brings in new and fresh ideas, but we can help support with our experience from being on the ground. The fantastic support that's available through Health Workforce Queensland is what probably was really surprising to me. When I was working in the NGO space, I benefited from that. I was able to do masters with the fantastic financial support, but we've been able to do that with PD opportunities for our different new grads and staff that worked over at Northwest, and I know Kidji have also taken advantage of that at different times. So I think that side of it's really great. And that you are a really good point that sometimes those positions aren't available on the coast, the provisional psychologists or the early social workers that want to work in mental health. So we're really lucky out here. They also often work at child safety, and that can be a really good learning opportunity for when they're working in the mental health space, just around vulnerability and risk and knowing how to support families and keep them out of that system wherever possible. I think probably just the other thing to mention is that they usually all know who's who in the zoo. So you get to make a support network quite quickly as far as other provisionals and working out how you get through your case studies and what the hell is this big national psychology exam that we've got to do and what are the good books to use for studying for that. So like any of the professions, I think that's been helpful. And I've just for some of the other students that in other disciplines, I think it's been really great when we've had EPs or OTs that have wanted to go on to further learning, and they've had people they can ask, okay, what further masters did you do, or what extra training did you do? What would be a good pathway for where I want to end up, and who can I access for support to do that? So I think that sort of fits with some of the other early career opportunities as well. I'm not sure if you have any other more direct questions, Victoria. Happy to answer them or message me, or we can, follow up after. Hopefully that's helped you.
Wow, you've fired my enthusiasm. That's incredible sounding. Oh my goodness. Just to convince my husband and my kids, right?
Yeah, we had someone move out here without them. So, and they're now gone into private practice out here. So it can be a great opportunity.
Jo, how were you convinced? Tell us your story about how you came to Mount Isa.
Well, my hubby is he's with Queensland Ambulance, and he got a position as superintendent for the Northwest Lessons. So that's how I literally fell into moving to Mount Isa. So, but embraced the adventure and just we've all our kids are adults and still living in Brisbane. So this was our little adventure, and packed up the dog and the cats and off we came. So that's how I ended up out here. So lucky. As I said, I didn't even consider rural and remote. Yeah, so blessed for everything that comes with it. So
you didn't require convincing?
Sorry?
You didn't require convincing?
Not at all. No, I'm a bit of a country girl at heart too. So no, not at all. And just expanding on that as well with the Queensland Ambulance, something that I also didn't know of was in rural and remote communities, Queensland Ambulance have an honorary officer program where you can go out onto the trucks. You don't have to be in the medical field, but you can go out on the trucks and assist the paramedics with their work, which as a newly graduated nurse is an amazing opportunity that I've just commenced, just to advance my clinical skills. So that's another opportunity that you don't get in the metro areas as well.
Yeah, there's also the Rural Generalist program that we have here, which provides support. James Cook University and the other key stakeholders like Northwest Remote Health and Gidgee in the Hospital also run a program that supports rural generalists that come out doing allied health disciplines and just supporting them through that early part of their career, level 1 and level 2. And the other thing too is that I left and came back. I've done that a couple of times now. And I noticed when I had my son, I was living in Townsville, and one of the worst things I found was that I didn't know who his friends were because there are so many people in Townsville. So I decided to pack him back up after some trouble and brought him back out to Mount Isa because I knew that everybody knew everybody here and everybody knew what your children were doing. And so kids just couldn't get away with anything because one time he cut his foot and at the fishing comp, and the ambulance officer that picked him up was a friend of mine and said, would you like to ring your mother or do you want me to? And he was 17 at the time. And he said, how do you know my mum? And she said, doesn't matter how I know your mum, we just need to call her. So it's just that type of sense of community, especially when you have kids, that I don't see on the coast. And the other thing is there's so much to do for kids here. Like people talk about there's nothing to do, but there's sports is insane. There's so much sports here for kids to do. There's lots of support programs and, people go camping. There's always activities like, especially this time of the year, there's always something happening almost every weekend. So, and a lot of it is directed towards families like Booyah Camel races and Family Fun Day for NAIDOC. So yeah, there's lots of things for kids out here as well.
Just to add to the story, going from the city to what attracts you to rural, I grew up in Sydney and I did all my schooling in Sydney. And the three things that attracted me was to get away from traffic, to get away from toxic people that lives in the city, and to see stars at night. So they were my three reasons to coming out bush. And another thing that a lot of people think is that, going out rural, you're going to be isolated. But, believe me or not, like I was tenfold more social when I was in Mount Isa than I have been in Townsville, Cairns combined. There's always something to do, not just for kids, but like all the students online. There is something happening on Tuesday night, you got trivia at the Buff Club. On Thursday night, you got salsa. And then on Saturdays, you're going out to Lake Mundara for having a kayak. And together with all the other events, you meet a lot of people who are very like-minded, but also in the same boat, which is what I found. And what is something that I'm really looking forward to when I'm moving back out to Mount Isa.
Thanks, Vid. I'm going to open the floor up to the students. If you, like Victoria, if you want to unmute your camera and just ask a question directly to the panel, please feel free to do so now, and we'll just take your questions. No? Don't be afraid.
Sarah, did you have a question about RMO campaign in Mount Isa at all?
No? Right. Well, while the students are getting their courage levels up, I just would like to kind of do the turn around what we've been talking about in terms of mental health and looking after the well-being of Mount Isa community, and to talk about how, as health professionals, what challenges you've had or what strategies you've adopted, maybe a successful strategy or even an unsuccessful strategy, just in terms of looking after your own mental health and well-being.
Danae and I can start if you like, just talk about a couple of things. I think for myself, just keeping active, and there's a lot of different things here. There's Thirsties, like a social running group on a Thursday night where you meet at a pub and then you go for a run and then you go back. And I think, Sam, you help run that, don't you? But just those sorts of things, and having those, I suppose, those friends or connections that you can really have honest and open conversations with, and just say what's on your mind. I think that other thing as well, like I was saying, if you experiencing or hearing comments around racism or different things, just knowing yourself how to handle that and who to talk to as well. They're probably like my big things.
And if I could add on to that, I would say you can never have enough mentors along your journey, and you'll just keep meeting people that add to your network, and they'll be far and wide. I have mentors in Alice Springs all the way up to Cairns, who I touch base with, and we work together. And I have learnt so much from my mentors, and those are the people that I can turn to have conversations outside of work. That's a safe space, and I found that that's been one of the best things for me.
Kirsten, I think you do some. Do you do some mentoring work or support for the health professionals?
Hi, Meredith. Yeah, so at the Centre for Rural and Remote Health, when the students do come back into remote areas, or even if our students don't come back to Mount Isa, if they do, so I've got students down in Inverell who are working there, and Dalby and Roma as well. So it's really good because of the virtual platforms we have now, we're able to bring them all together in that one place and sort of talk about, because even though we might be north, central and southwest, the challenges we come across are the same, and a lot of the clinical caseload is somewhat similar as well. But then if we do get that challenging client, I guess we can sort of say, hey, this is our experience. So if somebody else does come across it, we can do that as well. And then I find also being in a remote community, also a lot of the big wigs in your profession are quite willing to help you. Reason being, if you reach out and you're like, hey, I'm in a remote area, I have no idea what I'm doing, they're sort of like, oh yeah, no, sure, we'll give you all the information you need. And that's actually really good because you can network that way as well. So that works really well.
Thank you.
I think also, I guess speaking for the management level and the career opportunities that do exist to get us here, the majority of the managers, like Linda, like myself, we've been on the ground and we completely understand, you know, the barriers, the challenges, the feeling of absolute burnout at times, because you have this high empathy to try and help everyone you can, and you're only in community once a month. So, you know, you work those really long hours. You start at 7 o'clock in the morning to be there for breakfast club. So you see the kids and you're doing cough, breathe, blow to try and teach them how to blow their nose and you know, look at otitis media and reducing the occurrence. So you're looking at this public health side of things, and then you're trying to pump out as many patients that you can possibly see in that day. Try and grab your high risk clients. You're in the car, you're traveling around community, trying to find, you know, that one person that you know has an active wound and you need to see them. So, and then by the night time you come around, you've got, you know, other social groups that are happening in community that you know you might be able to get access to some of the other clients that you haven't got through the day. So really long days at times. We know that as managers, we know that we've got the empathy there. We're health professionals ourselves. So I think that identifying burnout really quickly, understanding that burnout happens in rural and remote communities, and having very strict, you know, our policy is 76 hours in the fortnight. So, you know, if you've had a really big trip, you know, in the first week and the second week, you've got a day or two in Mount Isa, you know, those Friday afternoons that everyone's back in Mount Isa, I can guarantee that they're not in the office. They've already done their hours and they're out there. That's when I get all my work done, is because no one's in the office on Friday afternoons. So I think having managers that understand what it's like to be on the ground is a very big benefit and a big support for mental health and well-being of the clinicians out here as well.
Thanks.
Yeah, I can definitely. Oh no, sorry, you go, Linda.
And I think it's a very, thanks, Jacob. I think it's a very forgiving place too, because I think that we all, especially with new grads, you know, it's wonderful. People come and they're so excited and they're ready to, in particular social workers, ready to save the world. And it's just so lovely to see that. And we appreciate that because, you know, it's great to have that much energy, but it's just allowing people to, you know, experience a little bit of pain so that they get an understanding about, you know, you may not be able to save the world, but what you're doing makes a difference for that person. So I think having managers that have worked in this area and have loved this work and have an understanding about how you can, you know, we're a bit okay with, it's okay if you don't do everything that you need, that you feel like you need to do, because we know that you're not going to be able to do everything. And the other thing is, and particularly for an Aboriginal person, I always try to get people to understand that really you can help, but at the end of the day, those people, Aboriginal people, it's about self-determination. It's not about doing it for people. It's about supporting them to get where they need to go. And for communities to get to a point where they're saying it's not okay, this level of violence in our community is not okay. It can't come just from clinicians that are visiting the community. It needs to come from the community and the people within the community themselves. So just, you know, those sort of levels of understanding.
Jacob, did you want to add to that?
Yeah, I was just going to follow up with what Rani said about sort of burnout, and it's quite. I think sometimes it's, you know, like for myself, I'm very much like the puppy. I think I've got that sort of puppy kind of mindset where it's just I could definitely see myself being someone who would burn out and sort of just going at it really, really hard. And, you know, it's good with, I think, being more rural. The flexibility as well was a massive, massive help, you know. Like, yeah, okay, first week I'll be out in community. I'll be doing very, very long days and sort of engaging with as much sort of, you know, patients and stakeholders as I can. And then, you know, by Friday afternoon on that second week, I need to be done by at least 12 o'clock, you know, provided that all my work's wrapped up. So, yeah, I think that's also a big perk is, you know, that I think they're a lot more accepting and sort of understanding that, you know, it's sometimes that flexibility is needed. That, you know, the clinicians are sort of hanging around a lot more and they're not sort of popping in and out every 6 to 12 months. And, you know, then that sort of continuity of care for the patients just all that rapport building just out the window. So yeah, I'm very, very big with that flexibility thing and sort of that care that I felt when I was a clinician at NWIH. So yes, can vouch for that.
Yeah, it's good that, you know, you will obviously feel safe to kind of be vulnerable and to, you know, seek support. You know, such an important part of, you know, ensuring that you guys are okay. I'm just mindful of the time, and I want to just spend a little bit of time on two areas which are really important to the students. The first one is student placements, and the second one is just about career progression, because I think that's a really important element of what you've really all talked about. And it would appear that, you know, Mount Isa is a student placement paradise. There's no doubt about that. And I just want to just run the students through an opportunity that Health Workforce Queensland have. We have a new initiative called Going Rural. It's a funding package to provide financial support for nursing, midwifery and allied health students to go on placement in primary care settings. So essentially that the funding is for non-Queensland health facilities. So we'll just put the page up for you to have a look at. So please visit our website and where the application form is, and hope that we hear from you. So Dinah, if you could share that, the Going Rural webpage with us, that would be great. And while that's coming up, the just to let you know that the funding packages are capped at $1,000, but it really is just to go towards your travel costs and your accommodation costs. We recognise that you know, non-medical students often struggle to find to get placement support. So this was why this program was put in place. It was for you guys. So hopefully that will help some of you. Thanks, Diana. So I'm going to, at this point, and I think there was a question, can students apply for the Go Rural funding before or after a placement? We ask that you apply before you go, so the approvals aren't, the funding isn't available retrospectively, but we do ask, you've got at least 10 days before you go on placement to apply. And you can go online right after this, after Go Rural virtually, if you like. It's a very short application process.
Meredith, can I just quickly jump in there also? With the funding thing, that was quite a big barrier for me going and doing a placement out there, because flights are extremely expensive to get to Mount Isa. If you actually have a look at your university, I don't know which university you're attending, but a lot of them do have scholarships for students to sort of go onto these rural placements. And a few of those I applied for as well. So not only have you got that, obviously the funding from Workforce Queensland, but you could, I don't know if it's ethically okay to be going into all these different buckets, but yeah, I personally found it very, very helpful, and it just takes that financial barrier out. So jump on your scholarships and bursaries page on the uni.
I think Linda's unmuted as well, so I'll throw to Linda, but the Centre for Rural and Remote Health and NWRH have a house. So if you're ever thinking about coming out here, we want students, we want new graduates, we'll take whatever we can get, you know. So if you're thinking about coming out here and you think that you're needing a little bit of additional support, don't think that you have to pay for accommodation. You know, we'll try and do whatever we can, and we'll help the other services out, whether it's, you know, if you've got a placement with Hospital and Health Service and they're your supervisors, or Gidgee Healing and you don't have accommodation, then the Centre for Rural and Remote Health and even NWRH are willing to help out. Whatever we can get you there, we'll do. So I'll throw to Linda just to talk more about the student placements.
Yeah, so we provide quite a bit of support for students. In fact, we do a lot for students. We provide accommodation along with Rani, so we've got quite a bit of accommodation. And one of the top tips that Joe has asked is one of the beautiful things that the Centre for Rural and Remote Health does is that we put all the students together and we have an orientation program, and we have support for them to do social activities, and we get them to do some volunteering in the community. So I think that makes it just a fantastic placement, because they, like Sabina was saying, you get to know about other disciplines. You're not just in your discipline bubble, but you get to know other disciplines and other people from different universities. But you also get the experience of having a supported environment around you for orientation, for a debrief at the end of your placement, for social activities during your placement, and engagement with the community that a lot of placements don't offer on the coast. So I think we do a really good job at supporting students and making the experiences as fantastic as possible.
Thanks, Linda. At this point, I might bring in Louise because she has a lot of experience of working with Western Queensland, but also with a lot of our speakers tonight. Louise, do you want to just run the students through the opportunities the Health Workforce Sponsorship Program offers them, as well as the incentive relocation package? Because I think they're important elements of you know, of how, you know, making the journey easier.
Yeah, definitely. So for me, I'm working with students, and they're calling up, and because we're advertising vacancies for most of the primary health services throughout Mount Isa, and there's some great opportunities for being a rural generalist, to speech pathology, OTs, every profession under the health professional umbrellas of general practice, as well as allied health and nursing. So for me, it's talking to the graduates, and I go out to Mount Isa on a frequent basis and meet up with the teams and talk to the supervisors and team leaders and find out what their needs are for the particular position that they're looking at, and making sure, you know, when I'm speaking to applicants such as new graduates or people that are about to graduate, is how they can actually, what experiences they might have done through volunteer work, their placements, and how they can bring that to the actual job and for applying for that position. So giving them a bit more understanding of the role as well, and getting them a clearer picture of how they're going to get such a great experience with being a rural generalist, as well as becoming involved in the community. So with that, we also support them if they are placed in a permanent role. We can support them with an incentive relocation package. So it's actually, we understand with new graduates, and there's been a few here tonight on the panel that I've supported with relocation packages. And that just helps, especially with new grads, if they're having to pay to get to Mount Isa, and as Jacob and a few have mentioned, that flights and relocating your personal belongings can be expensive. So we actually support them with getting out to Mount Isa and getting them on the ground running, so they're not having to stress about all that as well. And then when they're actually in the job, there's a really great support for continual professional development under the scholarships and bursary program. Now, this scholarship and bursary program is an excellent support for upskilling in the areas that you might have come as a new grad and you want to actually go into an expertise, or you've spoken with your team leader and you've worked out there's areas that you need to go into that need to be specialised for the areas that you'll be supporting in the clients and the patients that you'll be seeing. I know Joe's at Leichhardt Medical has accessed the scholarships and bursaries to upskills in some of the areas there, as well as Lynette, you've mentioned that as well. And I'm sure, Rani, you've accessed the scholarship program as well. So that can be up to $10,000 a year for 12 months period. And that's for postgraduate courses under the scholarship program. And then the bursaries provide CPD, such as training workshops, conferences, online courses as well to upskill in your area of profession. Now, you just have Mount Isa is the ideal spot for that access, because you just need to be in a MMM 3 to 7 and working as a health professional for a 12-month period, or more have contract for permanent placement. So I'm sure some of the people on the panel tonight can vouch for that program as well. How have you found it?
Louise, I'm going to jump in and I'm going to link, Meredith, your next topic about career progression. So Health Workforce Queensland have absolutely helped me, you know, as a clinician, as a podiatrist. You're stinging to get to that next position, right? I was a podiatrist out in these communities for 4.5 years, and I was like, what do I need next? So, you know, 4 years out, I had a look at what's next, and it was clinical progression. And I love diabetes, I love chronic disease, and I was seeing so many presentations of wounds. So the scholarships helped me into the graduate certificate of wound care. So clinically, this allowed this career progression to advance my clinical knowledge and understanding of wound care, which then helped me deal with some really complex cases that were coming my way. Moving on a few years later, I decided that I can't keep up this travel, right? I can't keep going out to these communities every single week, and I probably needed to stay at home and see if I could live with my husband before we got married. So I stayed in Mount Isa and I worked my way up into team leader. So I was a team leader for a few years, and then again, once you've been here for a little while, I'm 32 years old and looking after 50 FTE, looking after 35 communities. I look after Townsville Hub, Longreach Hub, And so what I needed then was, you know, the piece of paper to say that, you know, you've done your health management. So again, Health Workforce Queensland gave me a scholarship to do my master's in health management, and it's Lynette also jumped on, but she did the double degree in Masters of Public Health and Health Management. So, you know, and I know that there's a whole heap of Gidgee people as well that are jumping in and doing their Masters of Health Management or Public Health, and really utilising the Health Workforce Queensland scholarships and bursaries to be able to advance their career and follow that career progression.
And just to add on to that, we actually do advertise all the roles that are coming up in Mount Isa throughout all the different professions. So as a new graduate or looking for a future role, there's lots of examples on there of how to apply, and just able to support you through that process and link you up to these fabulous people that we're talking to tonight.
Thanks, Louise. Diana, do you want to share the Health Workforce Scholarships Program website? And Lynn, perhaps you could talk about what you've managed, you know, how you've utilised the scholarship program while that webpage is coming up on the screen.
Sure. Yeah. Yeah, I love Rani's example because I just think it's just a classic pathway that we'd love to see everyone go through. So I love it. Every time you tell me, Rani, I never get sick of that story. Yeah, I was really lucky to be working at North West Remote Health, and I had started in a team leader role as a social worker looking after the mental health and family wellbeing team. And Rani had told me about the training study that she'd been doing, and I got to hear a little bit about the health management stuff she was learning, and it was really interesting to me. And while I was doing social work, I had become interested in the public health lens and how we can move people through their health to better health and enjoying the environment that they're in. So I was really lucky that I got to hear about the scholarship and did subjects whilst I was working. So it was fantastic just to have the pressure off. It was a really easy system. And I think without the financial support, it would have been a lot tougher decision, but it took away those barriers, I suppose, for me, and was helpful for any position, really. I felt like I could attend meetings with the executives and be able to understand what they were telling us and why. So it took away some of those reasons when sometimes you get frustrated and you might not understand some decision making, but actually it really helped me understand why some decisions were made and why we needed to do things a certain way. But that has helped me in other positions to be able to identify some quality improvement activities or to start a project with someone. Just, yeah, a lot. I couldn't speak highly enough of the scholarship program and Louise and the team that have supported me through that. So yeah, thank you very much. But it was an awesome process. And I think if I got to do some extra study in the future, when I work for an NGO again, I'm sure I'll be coming your way.
Thanks, Lynn. Diana, if you could just stop sharing the screen, I'll just jump into one last question. Thank you. So I just noticed there was, hi everyone, I was just wondering, are most of the CBD opportunities online, or do workshops visit Mount Isa? You travel to attend them. If you're traveling, would it be all the way to Brisbane, or do you do workshops pop up or in regional communities too?
I think it's Linda. I think it's a real mixed bag, because there's online opportunities and there's a lot of them, because you're rural or remote and people understand that you don't always have the opportunity and the finances to travel. But then there's, you know, opportunities in Cairns, there's opportunities in Brisbane. Like I'm going to the IHA conference, hopefully if COVID doesn't stop it this year. So it's a bit of a mixed bag. I think there's, you know, you do some in the community and I probably do less out of the community than I do in the community. The other thing is you get the opportunity, like Centacare just did some neuro training at the bus club the other day and just opened it up for any clinician in the community that wanted to attend. And I heard it was very good training, 2 days worth. So, so yeah, there's those opportunities that come up that different services will open up for other clinicians to attend if we have a particular person coming that's who has some really great skills. So there's that level of CPD as well that happens here.
I was just going to add too that Health Workforce Queensland, those scholarships pay for flights, accommodation and other things as well if you did want to go to some do some CP in a different area.
Thanks, Jenna. There's just a question, somebody's joined late and they're just concerned that they got the time wrong. So just heads up, if you want to, this will be uploaded onto our website so that anybody wants to go back over and listen to the discussion or catch up on names, you can do that. So just give us a few days and we'll have it up on the website, on the Health Workforce Queensland website. Unfortunately, guys, we've run out of time. I'm sorry, it was such a good session. Thank you so much. And we really hope that, all of you were inspired by what you heard tonight. And thank you to our speakers. By sharing your individual stories and knowledge, you created a bigger story that we can all be part of. Thank you. A final thank you goes to perhaps my not so silent partner, Diana, whose technical skills made tonight possible. Thank you, Diana. And just to say good night, and please stay on and just watch the sunset on Mount Isa. Thanks, everyone.